Hi everyone, and welcome to A&P with Dr. O. In this video, we are going to be looking at some anatomical terminology, and we will focus specifically on anatomical landmarks. This terminology is going to be a really important foundation because it's going to help us as we name other anatomical parts in the future. To help us visualize these anatomical landmarks, we're going to be using this figure from the Anatomy and Physiology OpenStax textbook. And we're going to start with an anterior view. This individual is in anatomical position. They have their hands at their sides and their palms are forward. And we'll go ahead and start with our first anatomical landmark. The first one is the anatomical landmark for the skull, and we use the term cranial. And then next we have the face. We will use the anatomical landmark term facial for the face. And if we focus in on the face, we have a variety of landmarks here as well. The forehead is frontal. The eye, we can use ocular or orbital. Either term is okay to use. For the cheek, we have buccal. For the ear, we have otic. The mouth is oral. For example, the cavity of the mouth is called the oral cavity. And then the chin, that landmark term is mental. If we focus next on the neck, we use cervical. And then here for the nose, we use the term nasal. Again, if we're thinking about body cavities, the cavity associated with the nose is the nasal cavity. If we go ahead and focus in on the trunk, here we have the chest, which is going to be thoracic. Next is the breast. We use the term mammary as our anatomical landmark term. The abdomen, abdominal. Here is the navel, where the umbilical cord has fallen off. Therefore, we use the term umbilical. And then next we have the pelvis. Pelvic is the anatomical landmark. Then we have the pubis area. We use the term then pubic. And then when we're talking about the groin, we use the term inguinal. If we focus in on the thigh, femoral is the term that we're going to use for the thigh. If we come back over to the right side of our figure here, The armpit is going to be axillary. And then this upper part of the arm here is brachial. The front of the elbow is antecubital. And then the forearm is antebrachial. Next, we have the wrist. We use the landmark term carpal. We have the palm of the hand. That will be palmar. And then we have the thumb, and then we have the fingers. The thumb, we'll use the term pollex. And the fingers here, we will use the term digits or digital. Next, we have the knee. Patellar will be the landmark for the knee. And then we have the shin, which is crural. The ankle, which is tarsal. And then we have the toes, and then we also have the great toe. The great toe, we use hallux. And then the other toes, just like with the fingers, we're going to use that term digital. And there's our anterior side.